Welcome back to another episode of the Diabetes Survival Guide show. I am joined by a phenomenal guest, Dr. Austin Colish. Not only has he been amazing in the lacrosse field, but he's also been an inspiration for people with type 1 diabetes who aren't quite sure if they can go in the realm of becoming a doctor, becoming a medical provider, or becoming a physical therapist, as well as even becoming a national athlete. So I'm very excited to have Austin here as the guest, and he has phenomenal insights that I cannot wait to share with y'all. So without further ado, Austin, please share a bit more about the things that I didn't ask and tell us about yourself and your diagnosis story.
Sure. Yeah, Patrick, thank you so much for having me on. One of my resolutions for the year was actually to dive more into diabetes advocacy. It's something that's always been on the back of my mind and super excited to be here on a platform to talk about diabetes. Hopefully, more of these conversations can continue to happen as the year goes on. But yeah, my name's Austin Colish. I'm a doctor of physical therapy. I am based currently out of Baltimore, Maryland, and I serve as a sports physical therapist with an outpatient group called True Sports Physical Therapy. A lot of the patient clientele that we work with is high level athletes, and that's ranging from middle school, high school, college. We see a lot of pro guys and even semi pro athletes. And I'd say really my bread and butter is working with those post operative ACL patients. So that's an individual who's sustained an injury in the field, went and got an ACL surgery, and now they're trying to get back to that prior level of function. So that's what I do day to day. But I've been a type 1 diabetic since 2004. So I was diagnosed at age 10. Do the math, I'm 29 now. It's been a while. Back then, when I was first diagnosed, my diagnosis story, I'm sure it's probably not so different from other individuals who had experienced type 1 diabetes, but at the time we had no idea what diabetes was. My understanding and honestly health literacy, well, especially as a 10-year-old, but even just like my immediate family unit, we had no idea what that was. A lot of the symptoms that I had started to experience now, having the education and the hindsight to look back, it was hyperglycemia, and I had sustained that for probably weeks at a time, and I was definitely in a state of ketoacidosis. Um, so I always tell this story. I was going on a trip to visit my cousins out in Chicago, and I went with my grandparents at the time, and God bless them. I probably was the worst passenger for that long drive out to Chicago because literally every 15 minutes I was like guzzling down water and I had to stop to pee. And my grandfather is like he's like one of the nicest people and calmest people I've ever met in my life. And that was the only time in my life that I ever see him like snap and be like, "What is going on? You just peed 6 times and it's been like an hour." So fast forward to that, it was like a week trip there. All those symptoms continued, and then when I got back home, I remember seeing my parents. I think at the time I had lost like 10 or 15 pounds
Mm.
just because of the ketoacidosis that I was experiencing. And my mom immediately was like, something is not right. So we went to my family pediatrician. They did a whole bunch of tests, blood tests, urine sample. And I think it was through the urine sample they saw that huge spike in blood glucose. They then sent me to another hospital. And then I actually remember, I think at some point, because I was transferred between hospitals, I think at some point they had given me some type of dose of insulin. And I remember in the ambulance transferring from one hospital to the other after I had been initially diagnosed. I think I experienced my first low because I think that's the only time I can remember actually passing out. And
Oh,
that was in the ambulance over. And then from yeah, ever since that point, July 17th, I believe it was, in 2004, my life completely changed. So the next weeks ensuing was like it was a week or two in the hospital and just going through that process of meeting with the endocrinologist, getting a lot of time with a diabetes educator and the nursing staff there, all of them like explaining to me what is this process. And I think the most bitter part of that was at the time, we didn't really have an understanding of like why this happened. I don't have an extensive family history of diabetes in my family. So I think that was really frustrating to have this like life-changing moment and be forced into the hospital. And then now I'm face to face with these healthcare providers and they're saying, hey, this is what's happening in your body. You now need to stab yourself 8 times a day with a needle and draw blood and test yourself. You now need to give yourself injections with a syringe because at the time, insulin pumps were not a thing. Continuous glucose monitors were not a thing. And I remember just being really frustrated as to like, why did this happen? And I felt like I never got a clear understanding of that. But yeah, it was a lot of time in the hospital just learning about, okay, counting carbohydrates, learning how to dose insulin, learning about like bolus windows. And I think the healthcare team did a great job. I'm originally from New Jersey, so it was, I think, in Morristown Hospital. And they did a good job, but it's a lot for a 10-year-old. And I always like to throw in there, like, in the next 2 or 3 years, I was in 4th grade. The year following, I was in 5th grade. I got diagnosed with celiac disease, which I later found out that are pretty closely related because of the autoimmune nature of those 2 diseases. And then, like, during this time, I'm also transitioning into middle school, and then my parents are also going through a divorce. So
Oh,
I always talk about, like, this time in my life, I think was really defining for me because one, just being a middle school kid is super awkward, but to add on all these like other layers, I think that speaks a lot to the story of who I am today and where I am now.
thank you so much for sharing that. I am like my jaw is just dropped from that entire thing. It's a lot to process, I will say. And from that, being in middle school or in the transition from like elementary school to middle school,
Yeah.
family situation, getting diagnosed with diabetes, were you also playing like any sports while you were around that time too?
Yeah, so this is like my favorite fun fact. I didn't play any sports growing up. I didn't really come from a sports background. Now that I'm in here in Baltimore and the Ravens are like totally kicking ass, everyone just is. They're like, "Oh, like you're from Jersey? Are you a Giants fan?" I didn't watch football growing up, so now I'm a Ravens fan because I'm here and football's fun.
Yeah.
But yeah, no, I didn't play sports growing up. I didn't watch sports growing up. I have an older brother. He works and lives in Cali. He's very much in the tech and video games world. Like,
Oh,
I'm
that's
a
awesome.
massive nerd. Like, I played video games growing up. I was a Boy Scout growing up. We would go and play, like, D&D. So I'm, like, a hardcore nerd. I still am. So that's one of my favorite things to tell is that I came into the sporting world really late, and, again, I think all these pieces in the way that they fell into place totally tells my tale of where I am now and why I'm so passionate about what I do, and really, that's how I met the sport of lacrosse. So my whole life I had been like a bigger kid in terms of like just size and frame. And I heard all the time, "Hey, you're pretty tall. You should be playing basketball. Hey, you got some size on you. You should play football." And I don't know what it was. I just never had interest of that. And I can definitely speak from a mental health standpoint going through that, especially through middle school. And middle school is weird. You're just learning about yourself. You're trying to fit in. You're trying to find out where your crowds are. So I remember I have like distinct memories of in middle school lunch, like sitting down. And again, I had been diagnosed with celiac disease, so I can't eat gluten. Like eating, like I would have to go to the nurse's station, give my insulin dose through syringe, then walk back, and then I would eat these like rice cakes with peanut butter on it because it was like the
Oh
only
my
thing I could have. Gluten
gosh.
free bread was not accessible. I just remember being like, "Oh, God, I'm so like I'm totally the weird kid here." But my mom, she pushed me. Shout out to her. She was like, "Look, you got to do something. Like, you need an outlet that you can just expend energy and be part of a community and try something new." So I had pushed back on her a lot about playing other sports. And then one summer, I think this was going into my 8th grade summer, she signed me up for a lacrosse camp. I had no idea what it was. And she's, "Look, I don't know what this is. I heard about it from someone. It's a sport. Like, we're gonna bring you there." And I remember going to that lacrosse camp that first day and me just looking, what the heck is going on here? I had no equipment, and the coach who ran the camp, he was awesome. His name was David Brothers. Shout out to him. He ran this awesome camp every summer, but he gave me like the first stick I ever had. He lent me equipment for the camp for the week, and in my head, I remember, wow, like you get to wear like a helmet and gloves and hold this like this weapon. I was like, this is sick. I'm like a knight or something. What I learned from that experience, though, was the power and the effect of exercise on just diabetes management, but also all those other, not specifically physiologic adaptations, but just you feel better when you run around all day. And yeah, it was awesome. Like, I learned how to compete. I learned how to, learn and put my body in a different position to learn new skills and adapt, teamwork. So I'm a huge champion of that. And it's a little cliche, but I say it all the time. Like, the sport of lacrosse has saved my life
Mhm.
in so many ways. And it's why I'm so passionate about it now, because I still feel like I have a lot to prove from a professional standpoint and the individuals I work with, but also as a player. We just had a game on Friday night. I still play in a men's league, and I'm still pushing myself to get better because I feel like I came into it so late. And it's really unique to be down in Baltimore, where a lot of these kids they start playing lacrosse at 4 years old, and
Mhm.
I always look at them. I'm like, man, I wish I had access to these resources these kids have. But yeah, just to jump forward, I stuck with it, and I continued to play through high school. And really, I think my journey through diabetes management is really intertwined with the process of learning to become an athlete and actually developing as a lacrosse player. As I'm sure it's not easy to play at a high level and to manage your blood sugars and to know when your next meal is and to know what to eat after and all those kind of intricacies.
Wow. Thank you so much for sharing that. All those bits of insights from having your mom have that awesome conversation to say, "Hey, Austin, let's like focus on something to have an outlet," and then falling in love with lacrosse and then being able to utilize that to have fun thinking that, "Oh, I'm a knight. Like I get to use this stick, I get to have this helmet and I get to just run around and throw some things at people." It's a great time. And then being able to utilize that to improve your health, your blood sugar, your mental health, and all those factors, which is crazy. And then you decide to come to Maryland, where lacrosse is, I think it's considered one of the state sports in this state. So that's why a lot of folks are learning how to do lacrosse while they're 4 years old.
Yeah, it's crazy. There's definitely some rose tinted glasses looking back on that. It was not as easy as my mom saying, "Hey, you should do this," and me being like, "Okay." There, like, I'm sure she could tell you there were a lot of like tears, me crying, "I don't want to do it." But I'm super thankful for her to initially really push me on that journey and to stick with it. And yeah, it's been great.
Yeah. For me, I'm just thinking, man, what does it take to get a gamer to play some sports? Because I'm also a huge gamer and a huge nerd and a geek. And then I didn't get into doing sports until I think it wasn't until maybe middle school or high school where I actually got into wrestling and track and field and cross country for my senior year. And I didn't really understand or get into sports until like way late compared to everyone else. And then when I was coaching the little league wrestlers, I'm just like, dang, if I would have started when I was younger, I would have been so much better as the athlete that I can be. So I totally empathize with you there of, man, I wish I could have
Yeah.
started sooner if I was exposed to the opportunity back then. But here we are now, and we're just living our best lives.
Yep. No, always. And again, I mentioned this before, but a lot of my experience with that is what drives me to do what I do now.
Mhm.
I'm a really big believer in you need to provide and almost be that person that you wish you had growing up. So that's really what I aspire for.
This is why I have this podcast too, to have other folks share their insights and knowledge to someone who's out there that is the younger version of you.
Yep. Yeah.
All right. The other thing I wanted to know, what was it like managing your diabetes, blood sugar levels, medication management while you were playing lacrosse, both on and off the field? I'm sure the audience members are like, wow, I want to know more about that.
Yeah. Yeah. Depending on like how deep you want to get into the like specifics of the diabetes management, I'll go like top level first. And actually, a lot of this, my experience with diabetes education and the resources I had available to me is really what pushed me to the field of physical therapy. And that's a
Hmm.
separate conversation I'm sure we'll get into.
Oh, yeah.
Um, but the short answer is it was hard. It was really hard in those early days when, again, I was a largely sedentary individual. Again, I don't think I was like significantly obese or out of shape, but the reality is for someone of my age at the time I was diagnosed, I probably was not as active as I could have or should have been. So I think as I started to develop and mature, like skeleton just by going through puberty, but also as I started to really, again, get into sports and playing consistently. And then once I got into high school, I think it was around my sophomore year, is really when I learned and found the weight room and learned the strength and conditioning world. So my sophomore year into my senior year, I really took a deep dive in training and taking that seriously, but the short answer is it was hard, and a lot of that came down to I think education and again the resources I had at the time. So I wasn't on an insulin pump until I think my freshman year of high school. So that whole starting elementary school, fourth grade, up through all of middle school, I was using injections. And just for listeners, that literally looked like syringes that I would carry around. I would carry 6 syringes with me. I would carry around a vial of insulin. And obviously, I would have my glucometer where I'm testing my blood sugar. And I was doing that anytime I ate, I would have to take a syringe 15 minutes before and give a bolus. So that was hard. I think that was really tough. At the time, I was using like a quick acting insulin and then also a slow acting insulin. There was a short period of time before I got onto the pump where I was using Lantus, which is like a 24-hour long-acting insulin with also shorter boluses. I will say the pump was a game changer for me. Like being able to have it all not automated, but encased. I literally went from giving 5 injections every day to 1 needle every 3 days. That was a huge change for my life. And something that I didn't understand was how different modes of exercise impacted my blood sugar. And I don't know that anyone ever really explained that to me. It's something I had to do a lot of like self research, a lot of self experimentation. And it wasn't until I was almost graduating from undergraduate school with an exercise physiology degree did I finally understand, oh, this is why when I go for a low intensity steady state walk or I go for a hike for 20 minutes, my blood sugar plummets. But when I do a 10-minute sprint interval, my blood sugar spikes at the end. So yeah, I think my advice to anyone is who has type 1 diabetes and is playing sports right now is one, get a great diabetes educator, and I'll give my contact information at the end. I'm not a certified diabetes educator, but I can speak in my experience because I really think that it comes down to the individual. And at the end of the day, it's just you, the patient who has type 1 diabetes. Like no one is going to manage it for you. So having a really good understanding can help you best manage it. And again, I can give you advice, but I also know that it's very individual for each patient. Like I know I've met other diabetics and their routines look a little bit different. And that's just because different foods, different exercises, different plans work better for them. When I, so I played in high school. I was fortunate enough to get recruited and play at a small Division III school in Pennsylvania. So I played 4 years of NCAA at DeSales University. I had a great time there. And again, I think as I continued to develop as a player, because again, and I am humble enough to say this now, like I was terrible then, like my freshman, sophomore year, I was not a good lacrosse player or a good athlete. But I think in those first 2 years, it allowed me to reflect on my management and really optimize from a nutrition standpoint what I could do to make sure that I was going into a game feeling really good and then feeling good after. So to put that into context, I wasn't really sure what I should be eating before I go and work out. I wasn't really sure what I should be eating before I played a game. And then I would have this constantly frustrating experience where I would try to eat something before because if I didn't eat enough, I would drop low. And then I would be mid game having a low blood sugar, trying to guzzle get Gatorade on the side, which is not ideal to then run around with a belly full of Gatorade. Or I would eat something and then I would be too high, and then I would be so high and I would play in a game where I actually felt couldn't like move almost. And then you're just like fumbling with like the pump, like on the sidelines trying to like dose insulin. So it took a lot of trial and error. And yeah, again, I don't know how in depth of specifics of what you want to get into, but I think like the big takeaway is definitely a lot of trial and error.
Oh yeah, that sounds very familiar to one of my inspirations and not one of the people who has type 1 diabetes and has an amazing podcast called Diabetics Doing Things. So Rob, he played basketball a bunch of times and he was talking about how back then he didn't have the pumps to try and automatically adjust to it, so he had to physically get off the court to manage it appropriately. And he would notice that whenever he's in his highs, his coordination would just be very off and sluggish. So whenever he tried to do a 3-pointer or a 2-pointer, he would notice, oh, that's not a good one, and he could feel how slow his body was. compared to what his mind was trying to tell the rest of his body to move. And then same thing with the lows where he just felt completely exhausted and gassed and needed to come off to try and get more glucose into him, whether that's like a form of fruit snacks or whatever things they had on the side for him until he was able to get a continuous glucose monitor and an insulin pump so that it could help adjust and regulate those levels a bit more effectively compared to having to do it manually all the time.
Yeah, it's to your point about the CGM, that was an absolute game changer. I've been on a CGM for I want to say 5 or 6 years. I just got onto the Dexcom because I was previously all Medtronic and they have all their own devices that communicate with each other. And I was like, oh, I've had it forever. I'll just stay with it. But I got on the Dexcom and that thing is awesome. So if
Mhm.
anyone's like on the fence, just go get it. Like your life will be so much better. I am not paid or endorsed by them, but do it because just having access to that data and it is so freaking accurate. Like the technology today is crazy. But yeah, I prior to a really defining moment in my life, and again, like this kind of set me on the path towards physical therapy. I wouldn't play with a pump in. I again didn't really have a clear idea of what to eat before, and there were a lot of times where I was playing a game at 400, and
Mhm.
for anyone who's type 1
My
who's had their blood
gosh.
sugar get that high, like, it does not feel good. And, yeah, from a performance standpoint, it's terrible. You can't move, you can't think, you can't breathe. So, it's staggering how significant the relationship is between my current blood sugar and my on-field performance. If I'm in range and I'm feeling good, like, it shows. When I'm off, um, yeah.
How did you learn about physical therapy and exercise physiology? Was it through playing the sports or was it through looking it up or what was that experience like?
Yeah, I had a really unique opportunity in high school. I went to a magnet high school. And so how that had worked was there were like five different campuses within five different, or I'm sorry, it was a single campus with five different schools of teaching. So there was like the health and science school, there was the performing arts school, there was like a general like trade school, then there was also a technology and business school. And so I think a lot of people, if they met me now, they would automatically assume I was in the health and science school, but I wasn't. I was in the tech school because I thought I was going to work for Google one day and be a tech bro. I learned like JavaScripting, I learned like A plus hardware stuff. Like I was like really deep in there. And then again, some point in high school it just clicked. And I think this was really at the peak of me falling in love with the weight room and training and the exercise physiology side. I decided, okay, I do not want to sit at a desk all day. I want to be in a career where I'm up and moving. So that really influenced my decision to pursue sport and exercise physiology. That was my undergraduate major. I also got a minor in psychology, biology, and biomechanics. I was in love with the world of sports and the idea of movement as medicine. At DeSales, my undergraduate school, we had a club that was called Exercises Medicine, and I loved that idea. I love that philosophy. To be honest, though, I had no idea what physical therapy was. I had never been to a physical therapist. I had injuries, but none serious enough to warrant me actually going. So I talk about this often. I had no idea what PT was until I was like in my first day of PT school, sitting down and being like, wait, what did I sign up for? But that defining moment I alluded to earlier came in the way of me meeting with a physician's assistant. And so when I was at school at DeSales University, I had to relocate my endocrinologist to be someone who was closer at school. So I would have my every 6 month checkup. And I just remember my sophomore year being really frustrated with my diabetes management and really experiencing some of that burnout. And part of that was because I felt it was a big piece in setting me back from my on field performance. I knew that like I had a really high skill gap to make up just because I had started the sport so late compared to a lot of the people who were on my team. But I got really frustrated because it was almost every day at practice. I would go, I would be high and then drop low. And then as soon as I would correct, I would be high again. And emotionally, it's taxing. Physiologically, it's taxing. I got really frustrated with that process. And I remember going to my endocrinologist at school for my 6 month checkup. You go in the office, you wait there for 45 minutes. The endo comes in, he looks me up and down and goes, your A1C sucks. You need to do a better job. And it's okay.
Oh,
And he's, are you counting carbs? Yes, I'm counting carbs. Okay. And then he was just like, all right, keep working on it. And I was like, Doc, I'm really struggling with the sports side. I'm a college athlete. I want to play well. I feel like a lot of my highs and lows are because of you wake up for 6 a.m. lift, you go to class all day, you eat throughout the day, and then we have a 3 hour practice. Like, how do I manage that? And I didn't get any advice. And I
oh
got really
God.
frustrated with the
Oh,
healthcare process because again, you're waiting in the office for an hour, you meet the guy for 5 minutes just to say, hey, do a better job. And I'm not given the tools or resources to do a better job. And it's not, and I've met, now that I've been on the healthcare side, I've met patients who do not want to hear it. I've met patients who have access and they're just like, I'm not interested, or maybe they're not that stage of readiness for change. That was not me. I was coming with open arms saying, Doc, show me what I need to do better so I can be a better patient. And I was really frustrated with that process. So the number one thing that drew interest for me in the field of physical therapy was the fact that as a doctor of physical therapy, I get to work one on one with patients and I get to hear their story. Every single one of my patients, I can tell you 5 to 10 things about them in their personal life outside of their clinical presentation. And that is something I care about. And I felt like I was not shown that individuality or that patience or that understanding and did not receive that education through the greater healthcare sphere until I met a physician's assistant at that practice who she was awesome. Her name was Leanne, and I am forever grateful for her because she showed me that medical professionals can be kind and can go above and beyond and can be patient and can educate. And so she was in the room with the doctor at the time and she stayed way later than she needed to and talked with me. And then I ended up meeting with her exclusively moving forward. And she would send me research articles. We would have follow up calls talking about like different strategies in terms of management. So it was because of her, I had an understanding. And again, a lot of this that we're talking about is just education. So that required her to either dig up her textbooks or go online, search PubMed, and get some articles. But she educated me and gave me tools that I could implement in my own life that had again staggering effects on field because now my blood sugar was managed better. And simple ideas such as, hey, before you go and play a game, let's pair some of the carbohydrate you're eating before your practice with a protein and a fat. So that way we have a steadier incline in your blood sugar. And then before you play, let's keep the insulin pump in, but then let's reduce your basal output. So instead of going all sugar, no insulin, high on field output, like high physiologic stress, it was a little bit more baseline. And it was insane what that did for me. I felt better, I played better, and it really changed how I viewed myself as an athlete, how I viewed myself as a diabetic, and also how I viewed healthcare as a whole. It's a little weird because I feel like most people who are PTs have had some type of experience where they were injured and they had a great experience with the physical therapist. But yeah, it was really this physician's assistant, and that's what drew me into the field because I was like, well, I get to work with people, and I'm not just going to be a doc who shows up and says do better and then leaves. That was really my inspiration to get into the field.
wow. I'm getting so many chills right now, especially with the story of that other doctor not wanting to listen to what your needs are and pour into you. Instead, it's more of a, all right, here's this, good luck. And versus someone, if I remember correctly, Leanne, right?
Yeah.
Yeah. So Leanne deciding, all right, let's give Austin the resources that he needs so that he can live his life, improve his quality of life, crush it on the lacrosse field, and really give him that education component so that he can take care of it on his own and empower him that way. And then that inspiring you to go into physical therapy school to share that same desire to have that personal experience with your patients, with your clients, and allowing them to succeed and know that they can do it. And all they need is just some small little tricks to eventually reach the goals that they're looking for. Just that small calibration that they need. That's awesome.
Yeah, and I think that small thing is what separates like a great clinician or a great provider from a less than one. And the only difference is that they care. Like you just got to
Mhm.
show that you care. So it's something I truly embody today. And Yeah, going back to PT school, I remember sitting down for the first day of class, learning about sit pivot transfers and the timed up and go test. And I'm like, what the heck did I sign up for? I thought I was going to be working with athletes, not learning about acute care management. But I'm thankful I stuck with it, and I'm super thankful for those people who displayed the kindness and patience and education that I needed.
Ah, so awesome. So, what would you say was the hardest lesson that you've learned through your personal journey with type 1 diabetes? And what did you learn from that experience?
Yeah, so I like this question. I think I have a couple of lessons I want to talk about.
Go for it. Share
Um,
them all.
the first one is don't judge a book by its cover. I know that's super cliche, but it's something I live every day. I almost take pride and relish in the fact that people learn I'm a diabetic as an afterthought. And I hope most people, when they think of me, they don't necessarily think diabetic. And I think I've spent a lot of energy and time to not let that title define me. Of course, I started the podcast by saying I want to talk more about it. I think it's important that we talk more about it, but I didn't want that label to almost crush me and pull me back. I hope when people think of me, they think of me as like the crazy lacrosse guy or the physical therapist or the dude who loves video games. So I would say that I think just because I look a certain way or I speak a certain way or I carry myself with a certain energy, that doesn't mean I don't experience burnout because I certainly do. I was talking with my fiance last night about it. I had a really bad episode a couple years ago where I just got home and it was just a bad day, like a lot of highs, a lot of lows, a lot of and for those of you who don't know, when you experience hypoglycemia or hyperglycemia, which is like a change in your blood sugar, there's an actual hormonal effect that takes place. Quite literally, my mood is very one to one with where my blood sugar is, and it is exhausting. And then it's just one of those things where I'm never not thinking about it. Every waking moment of my life, I am a diabetic and will be until I leave this earth. And sometimes you just need a moment to cry and break down, and I've been there. So I think that's just like a general piece of advice, and or I guess lesson is not to be defined by the title and not to judge someone by how they present themselves or maybe a category that they put themselves in. I think going off of that, like some other life lessons diabetes has taught me is I think life is literally about ups and downs. And that comes to me in the ways of obviously as blood sugars day to day. But I think there's a lot of parallels to other aspects of life love, finances, success, sport. That's why I love what I do because I see so much of that parallel carry over to each side of those aspects of life. And I think a good lesson there is to let the lows be lows, like when times suck, it's okay to let it suck, but just know it's not forever. And when you're on top of the world and you're doing well, like you gotta let the high be high. And maybe not from a blood sugar standpoint, but learning to ride the wave a little bit is part of it. And the last piece of a lesson I've learned through my experience with diabetes. This is a quote I stole from one of my professors in undergrad, and it always resonated with me. But failing to plan is planning to fail. And I really try to embody that from definitely in my professional world. I'm sure a lot of my colleagues would say that I'm almost annoying to the point of, okay, hey, I need to know what the plan is for what the next steps are. But that's how I need to think about my own life as a type 1 diabetic. And I think it's good advice for anyone who's trying to accomplish anything. Like you need to have a stepwise approach to accomplishing a goal. And maybe that's why I like playing video games so much. I love getting that endorphin rush when I see the achievement pop and I get the 10 points or whatever. But having a plan and knowing what the steps are to get to where you want to be is super, super important. And for the context of a diabetic, maybe that means you need to know, okay, I'm going to go for a run today. You need to know the distance, you need to know the weather, you need to know the intensity that you're going to run at. You got to know what your meal is before. You need to know what you're going to have access to. Maybe that means throwing a fruit snack in your backpack, what your plan is after, what your next meal is after, how much insulin you need to give before or after. So all of those lessons have been some ones that I've taken away from my journey.
Crazy. Being able to allow yourself to have that personal time where if you need to let it out and cry, going through with that, to then being able to say, hey, let's understand that I can be so many different, have all these different skills and interests come together to allow myself to be myself to then understanding, hey, let's make sure that I plan appropriately and understand the plan or create a plan so that I can set myself up for success and become the best Austin that I can be, to become the best like version of myself and continually do that to the point where people blink and they're like, oh my gosh, where did this person even come from? To, well, they just
Right.
planned appropriately and they just stuck to it and they made a change
Right.
accordingly to get to where they want to be. That's awesome.
Yeah.
So, with that being said, what would you say is one piece of advice that you would share to your past self when you're having your hardest moments or with other people who are having a difficult situation with their life?
Yeah. So I mentioned this earlier, but something I really aim for and try to embody is to aspire to be the person that you needed in your own life for others.
Hmm.
And like I said, I think a lot of how I take my approach for patient education, how I take my coaching approach, because I also coach lacrosse, and I really try to embody someone who I would have loved to have had in my own life as I was going through this. I think I got there eventually, but as you heard, it wasn't a clean experience, and there were definitely some ups and downs along that path, which is fine. And I think that's part of the experience of life. But just I wouldn't let a single moment define you. And again, talking about like those ups and downs and those highs and lows, with the context of diabetes, a single blood sugar does not define your A1C. A single mistake on the field doesn't define your entire season. So, like I said, I try to find a lot of parallels in the different aspects of my life, but there's a lot of pressure to be excellent all the time. I love social media and I love the access it provides. I know that also ramps up the identity of I am perfect all the time and I show amazing things all the time and this is the best all the time. That's not life. That's not how it goes. That would definitely be some advice that I give is just don't let those bad moments drag you down forever and again, just enjoy the good moments when you're there.
Hmm. Focus on the positive, focus on what you can control, and then
Yeah,
letting yourself know that, hey, this number doesn't define me. Instead, the stuff that I enjoy, the stuff that I want to do, the stuff that I want to continue doing, that's the things that would define me. And it's amazing because people get to choose how they are defined. So
absolutely. And
focus on the positive. There you go.
yeah, I think context matters, and I think having conversations like this matters too. When I was diagnosed and placed into that pediatric ward, I was there alongside patients who had full-blown cancer and were
Mhm.
undergoing chemo treatment. And I remember feeling a little bit like a fish out of water, one, because I was a 10-year-old in a hospital and was like, what is going on? But also because they were kids literally carrying the IV stand with them and experiencing chemo with all the symptoms that you would expect of that, hair loss, really feeble. And I remember thinking, man, like it could be worse. So I think adapting that mentality is important and having these conversations with people who aren't like yourself is a good reminder of just how complex the experience of life is.
Mhm.
And it is so, so vital. Yeah.
Ugh, it's such an inspiration, Austin. All right. So a few fun questions that I want to ask. What would you say is your favorite game to play right now?
Ooh, game to play right now. So I'm currently playing Baldur's Gate 3,
Okay.
which I am super into. It's like heavy fantasy, medieval. You just get lost in the world in your role playing. I love those types of games. So like
Oh, that's
Skyrim,
awesome.
like all those games. I love that stuff.
Yeah, I played Genshin Impact a ton, and that's also a pretty good time, especially with the story building. The only tough
Right.
part is like the gotcha games where you have to keep on paying more money to try
You
and get
pay
that
to win.
lottery
Yeah.
stuff. I'm just like, ugh, but I need the good characters. All right. And then what would you say is your ideal full course meal? So let's say you have an uh appetizer, the main course, the dessert, and then uh the ideal beverage.
Oh man. So I'm thinking back to some of the better meals I've had. I'm a pretty hardcore foodie.
Yeah, same here. I'll ask you.
I love to cook and I love to eat great food. I was so my mom's family's from Portugal. We're planning our wedding in Portugal next year. I
Woo,
love going to
congrats.
Portugal. We were there this past spring and we had this amazing a lot of the way that the Portuguese cuisine is prepared is like super simple. Like they catch the fish fresh, they salt it, they split it, they put it right on the grill, and then it's like right to your table.
Ugh,
So I think for me, that is like some of the best food I've ever eaten. So a full course meal would be like get some nice white wine, get some salad. They always have this great salad with olive oil. And it's like really rich olive oil and like vinegar, tossed all together, and then sardines on the grill, prawns or shrimp, and dessert, probably some type of ice cream. I
mhm.
love ice cream. It's got to be ice cream.
Okay, best flavor though of ice cream.
Oh God, I'm gonna get a lot of judgment from this. I love vanilla, man. Vanilla
Dude,
ice cream
what?
is the
Me
best.
too. Vanilla's my favorite.
Let's go. Let's go. Yeah, I get a lot of crap from my fiance. She's there's so many amazing flavors out there, and you choose the boringest one. I'm like, yeah, but it's the simplicity that's great.
Yeah,
Um,
exactly. You could pair it
yeah,
with other things as well. If you want a drizzle of chocolate, you could put that on there.
yep,
If you want
yep,
something savory to put on there, like vanilla goes perfectly with everything. Like it's the
yeah.
best.
Savory. So some of the best vanilla ice cream I've ever had was a scoop of vanilla bean with a little bit of olive oil drizzled on top and some flaky sea
Mm.
salt. Sounds weird, really good.
That makes sense because you have the savoriness and the sweetness of the vanilla, and then you have the acidity from the olive oil that
Yep,
comes in, and then of course the flaky salt with anything sweet and
it's
sour.
great. It's great.
Chef's kiss.
So good.
Delicious.
Yeah, go try it.
All right. And then what would you say is your zombie apocalypse survival plan?
Yeah, I love this question because, like I said, as a current and former nerd, something I've actually thought about a lot. So there's some precursor questions that I have in response. Are they fast or slow zombies? Fast. Okay, so then is it like 28 days later rules where like they'll starve if they don't eat, or they just go until they get shot in the head?
They go until they get shot in the head. I make it
Oh
difficult.
God, that's hard, man. Yeah, so I used to think about this a lot because I was a Boy Scout growing up. Got my Eagle Scout. Super proud of that. Shout out.
Dude,
But we would
congrats.
do this camping trip up in upstate New York at Sabatis, and it was awesome. It was like just cabin lodge, like in the middle of the woods. There was a lake and boats. That's where I'd go. I'd go right up there. Just live up in the woods, get a bow and arrow, get a rifle, and just live off the land in
Nice.
the wilderness.
That's similar to me where let's learn how to do agriculture so I could grow my own like vegetables and
Right.
fruits, and then learn how to
Right.
can so I could preserve them and make sure I'm good for the winter. And then something in an area where it's more secluded-ish, and then make it in a way where if zombies did come, I could see where they're coming from and I could address it easily, and I would have traps ready to go.
There
So
you
having
go.
that proper plan.
I love that. Yeah. Gotta have a plan.
Oh yeah. All right, Austin, it has been an absolute pleasure having you on this podcast. I know our audience is saying, how can we find Austin? I really felt his message. I really heard what he's saying, and I love seeing all the examples that he's been sharing with us.
Yeah, so the best way to find me is probably on Instagram. I'm at Lax Rehab on Instagram. I'm on there probably too much. I post a lot. Best way to reach me is shoot me a DM. My email is also on there. So if anyone has any sport injury related questions, if anyone's experiencing or knows of someone who's rehabbing an ACL and trying to get back to a high level of sport, if anyone has any training or strength and conditioning questions, I'm also a certified strength and conditioning coach. If anyone has diabetes questions or if anyone just wants to talk shop or talk about food or video games, I'm game for it all. So reach out. Don't hesitate.
All right. Thank you so much, Austin. And y'all just make sure you check him out. And of course, the thing that I always close with, just focus on one thing that you could do today and tomorrow that can improve your life. It's just something small. And that small thing will keep on stacking up until it becomes so big that you realize, wow, the simple things really do matter.